It's my privilege to be here, and I really look forward to these. I think it's a fun conversation to have, and certainly an important conversation to have. So we're talking about welcoming the T in GLBT, and welcoming where? Welcoming in the world, welcoming in our families, welcoming in our churches, especially in our churches. So I'm really glad to be here. I did want to stay here a little bit longer. After my name, you see my credentials. There's 3 of them, MD, Mom, and Methodist. I thought that was kind of cool, 3 M's. I'm here as a doctor, but not primarily as a doctor. As a doctor, I've had a little glimpse, maybe a little more personally, into some people's lives, and that has been instructive for me as a parent and as a Christian. And sometimes my involvement as a mom is instructive in my medical practice. So those are equal qualifications. They're not, one's not above the other. I want to introduce my family. This is a picture taken in 2008. I also want to introduce some of my other cheering squad that I brought with me today. My sister-in-law, Carolyn Pennington, is there. She is from Eugene. And her daughter, Lisa, is there in the front row. She's my niece. And then my other niece from Seattle, now living in Portland and going to medical school, is Anna Olson. So they were all here in 2008, and they were all here being supportive of what they thought was a lesbian wedding. So we have my husband and me on the left, my first daughter-in-law, Laura, my then daughter, Heather, who now goes by Henry, and then my other son, Trevor. By 2010, that had changed a little bit, and this is another wedding picture. This is Trevor and Cheryl Lynn's wedding. And off on the left, you see Henry. Henry has made a transition. Just 2 years. I think he looks pretty handsome there. But the fact that he's in this picture speaks to the level of support that he has received in our family. And that's pretty amazing, and pretty much a testament to why Henry has not suffered nearly as much as some transgender people do. He's just been accepted. So what are some of the issues? Well, we're going to talk today about what is the difference between sex and gender. They're not the same thing. Is gender identity different from gender expression? Yes, it is. It can be consistent one with the other, or it might be different. And is gender identity different from sexual orientation? Yes, it is. Let's pursue those a little bit more. So we're going to first start off with a little 5-minute video clip.
I know lots of people, lots of men, who have vaginas.
It's not always easy to be in the middle.
I so prefer someone to just treat me like a human being.
Our culture has a pretty simplified model of gender, or traditional gender model. A model that says someone whose body has a penis would be identified as male. They would behave in a stereotypically masculine way. They would identify themselves as a man, and they would date a woman. That's what our normative or traditional gender model is. Someone whose body, whose sex is what we consider female, has a vagina, would behave in a stereotypically feminine way, would then identify themselves as a woman, and would date men. A huge number of individuals in this world don't fit into those models.
I'm a trans man, female to male transsexual, but I identify primarily as a trans man.
I am a transgendered woman.
I identify as genderqueer because I feel like it's more accurate to how I feel in terms of my own gender identity.
People want to talk about transgender, and I always say you have to start by talking about gender. That's really the sort of critical piece in the word. I use a somewhat simplified version: sex, gender role, and gender identity. And the other piece I like to touch on is sexual orientation, largely because of its relationship to gender and the fact that sometimes people confuse it with gender. Sex is about physical characteristics, organic components in our bodies, anatomic aspects of who we are, sex hormones like estrogen and testosterone, and the chromosomes. And it's often strongly related to genitalia. What is gender role? Well, it's essentially a social understanding of how we are in a gendered sense in the world. It can be something that we do ourselves. It can also be something that other people see in us. And typically when you have a boy, you give the boy trucks, action figures. A girl, you might give dolls, sewing kits. These are very gendered decisions. We gender color, we gender clothing. It's fine for a girl to behave as in a masculine way, what we might call a tomboy, until she reaches puberty. And then she's supposed to sort of femme up, fit in within the more powerful gender stereotypes of what a woman's supposed to behave.
Because I felt different a lot, I think I overcompensated by doing things that were kind of like hyper feminine. You know, like I had long hair, I wore dresses, makeup.
Gender identity is nothing more than how we see ourselves in a gendered way. You can't look inside your body for it, it's inside your head, it's between your ears. People translate that into one of our common cultural choices, which is either man or woman. But clearly, gender has to be unique, because we're all too complex for us to state our gender in such a simple term. The relationship between gender and sexual orientation is important to discuss here. A lot of people think that one is the other and vice versa. When people say gay, they often think they're talking about trans at the same time. And I'd like to make a distinction that all gay people are not transgender and all transgender people are not gay. Everybody has both a gender and a sexual orientation. That's the traditional gender model. That's what our media uses, that's what our advertising uses, our films use that, our paperwork. When you go into an agency, people have to fill out paperwork. They ask you to check one box or the other. They don't give you any room for complexity. The traditional gender model doesn't actually fit large numbers of people, and we're really given two choices. We can either change the people or we can change the model.
Well, we're talking here about a whole bunch of definitions. What do all these terms mean? These are pretty small. That's why they're given to you as a handout. So if you didn't get a handout, I believe they're on the back table? Oh, they're on all the chairs. So find one if you didn't find one. And these are just for your reference. You can use them later, but they're not critical that you look back at them. But I just wanted you to have some clear definitions. So what is the difference between sex and gender? Well, sex is something that as a doctor who delivers babies, I get to determine. I hold up that new little baby, actually I don't, I press it on the, place it on the mom's abdomen, and I say, congratulations, you have a baby girl, or congratulations, you have a baby boy. And what do I base that on? I give a very brief 2 or 3 second look at that baby and make that proclamation. That's pretty arrogant. But I'm looking at what the baby looks like, and in most cases, I'm pretty close to right. But in some cases, I'm not right. By looking at that baby, I can't tell what the chromosomes are. I can make a good guess, but I might be wrong. I don't know what those hormone receptors look like. I don't know how high or low the hormone levels will be in that baby at puberty or after puberty. I'm only basing it on whether there's a penis present. And that makes a big determination on a person's life. More and more these days, many women are getting amniocentesis, and they are getting the diagnosis of an XX baby or an XY baby. Well, that's a pretty good approximation too, but it doesn't tell us everything. It just tells us what the chromosomes are. So children get declared either male, female at birth. And then we get gender role. When people have a baby boy, they tend to buy blue clothes, they tend to buy trucks, they tend to have the baby sit with dad on Super Bowl Sunday and watch these football games. They tend to buy princess costumes for their baby girls at Halloween. They buy pink. They discourage perhaps rough and tumble and mud play. And we socialize our children a lot, and most children accept it, and some don't. So we have masculine behavior and feminine behavior. Some of us are also socialized by our jobs. It used to be back in the 50s, I guess there's this golden age, when dads went to work and moms stayed home. At least for some people, that's the way it was. And then as women entered the workforce, many women were entering the workforce in typically male professions. The women had to go to work in overalls. They had to get down and dirty and grimy to be electricians, just like male electricians do. People like me entered a profession that was typically male for quite a while. So there's a lot of crossing of gender roles in many circumstances. But we still stick with those stereotypes fairly closely. And then we get to gender identity. This is what people feel in their brains they are. Am I male? Am I female? And this may have something to do with the gender role, or it may be different. If someone has been largely trained to be a woman, but feels like he is a man, there's a lot of stress there going on in that person's mind. So what do we call these other people who are not strictly following the paradigm? Well, the ones I talked about earlier, where we don't know what sex they are at birth, or we make the incorrect assignment of sex at birth, are intersex. And this is a condition where there are actually biological differences. Either the genitalia is neither clearly male or female at birth. Perhaps the chromosomes are neither female nor male. For example, I have 2 twin boys in my practice with XXY chromosomes. They look like baby boys, but they don't have typical chromosomes. So they will have some issues growing up, and I'm working with the parents on that, but not finding a lot of receptivity. They want to believe that their sons, their twin sons, are just like every other boy, and this is a struggle for them. So we have intersex people. That's not really our topic today. Our topic is transgender. So then we have people whose dress, whose occupation, whose behavior, whose preferences in life are, in terms of gender role, are kind of mixed up. And I would guess that most of us are a little bit androgynous. We're not 100% female. We're not 100% male. We're kind of someplace in the middle. And we may change from time to time. Sometimes it's an advantage to be kind of manly. If you want to go hunting, you probably have to have enough chutzpah to shoot something. But if you go out to dinner, many of us women will put on the pearls and the high heels and the makeup, and we'll look quite feminine, and then the next day going to work, we won't look nearly that feminine. So we change from time to time. And some people choose to change because they really don't feel like the stereotypes fit who they are. So it's not so much just a matter of convenience, it's a matter of who they really feel like they are. On the video, the young person who said, "I'm gender queer," would fit into that area. And then we get to gender identity. Just because a person is declared male at birth, has XY chromosomes, and has been raised as a boy, that person may not, in his heart of heart, her heart of heart, feel like a boy. This person may feel like I was born in the wrong body, a mistake has been made, or I have changed throughout my life in the years and I am no longer that little boy I was declared to be, that I really am a woman. And this is not based on biology. I kind of have to pull back on that. We're not sure what it's based on. But it's not based on the chromosomes. It's not based on anything that would qualify as intersex. It's a matter of self-identity, and it can only be determined by the person themselves. So a person who has a very masculine job, very masculine look, may decide that he is really a woman and begin a transition. And vice versa. Someone in the middle, someone who is androgynous, may decide that this has been a stage, I'm really not androgynous, I really am quite a woman, and begin to make a transition that is a full-time, 24-hour, 365 change, and to live full-time as a woman or full-time as a man. So that's what these folks are transgender. And then finally, not a question of who you are, but a question of who you love is sexual orientation. And a man can love a woman, a man can love a man can love both, a man can love a trans man, or a trans woman. So it is really, there's lots of different choices people make there, not choices, determinations they make about themselves, who they love. But that's completely separate from who they feel themselves to be. And so gay and lesbian people, bisexual people are really in the sexual orientation category. And what we're talking about today is people whose gender identity is not the typical, and is not the typical declared at birth, and maybe is on their birth certificate until the birth certificate gets changed. So how common are these variations? It's very difficult to know. Who do you count? Do you count people who've had surgery? Do you count just people who've had 1 surgery, 2 surgeries, 3 surgeries? Do you count people who've used hormones to change their sex? Do you count people who once or twice dress in clothing of the opposite sex, or full-time dress in clothing of the opposite sex? Do you count people just who go to clinics? So it's really hard to know. American Psychological Society says that 1 in 10,000 biologic males is transgender and 1 in 30,000 biologic females is transsexual. I should use the transsexual word for that. These are probably gross, low estimations. The World Professional Association of Transgender Health in 2007 put out some other information, and they said it was much more common, and are even estimating that transgender people are born in 1 in every 500 births. So it may be quite common, and I am willing to bet money that every single one of you in this room has encountered a transgender person in your life and not known it. So they're here with you. They are your doctors, your lawyers, your teachers, your children, some children you may not even know about, who may not have revealed to their parents and not come home since a transition. They are your pastors, they are your parishioners, they are your Sunday school teachers for your children. They are in all walks of life, and you may or may not know it. So be careful what jokes you make. You may hurt someone. So what are the causes? It's not really known. This is a great mystery. I think there's a lot of interest in this. Recently, with better medical imaging techniques, we have identified some differences in brain structure, and these will be investigated a lot more in the future. But there are some differences where transgender women's brains look a little bit more like biologic women than they look like biologic men. We also have been studying chromosomes and genes. The chromosomes, we know quite a bit about variations in chromosomes, and that certainly does not explain people who are transgender. But there are some 54 genes that code for different aspects of sexuality, and those genes interact with each other. So some will stimulate another gene or suppress another gene. So that's just now being looked into, the interactions of all of those. That may end up explaining some. There have been hypotheses that the hormones that bathe the baby during embryogenesis and during transition from a fetus to a baby determine whether a person is transgender or not. And that's been pretty much disproven by babies that are born, identical babies who share an amniotic sac and share the same hormonal situation. That was not true in my twin birth. They were completely separate. And then in the 70s, a pediatrician named John Money had the theory that you really could shape whether a person was male or female by how you raised that child. And this was a tragic case where twin boys were born and one of them had a circumcision that was botched. And so the penis was destroyed. The child, it was determined that the child would be raised as a girl. This child was raised as a girl, and it didn't work. The child, as an adult, finally determined what had been done to him at birth and transitioned back to being a boy, but too much psychological damage was done. He ended up committing suicide. So a very sad story. So pretty good proof that John Money's theory did not work, and a lot of damage has been done over the years with that theory. So I think we have to accept that we don't know. Stay tuned. Research is being done. We may or may not figure it out, but what we do know is that the kind of health a transgender person has is largely determined by the degree of support that that person experiences from family, friends, and society. And that we can shape. That we can change. We can change the training that young parents have as they receive a newborn baby into their families, and see if we can get some of those parents to not damage their children as the children are determining through their childhood and adulthood who they really are. We'll come back to that study later. So at what age do people identify? Pretty amazing ages sometimes. Some children know from a very, very early age that the gender identified to them at birth is incorrect. Preschoolers, we think this occurs around the age of language development. Some children do not really give it much thought until they're in the preteens. And then when those hormones kick in, it can become quite traumatic because they've probably had an inkling before, and then the girls begin to develop breasts and start to have menstrual cycles, and my gosh, I no longer have this choice. Now I am destined to be this female, and I don't feel like a female. I feel like a male. And so that is a very risky time for young adolescents. Late adolescence is another time. Many times these children have figured out that they're different, and they think, well, I must be lesbian. A girl may say, I must be lesbian because I certainly am not like all the other girls who are going gaga over the guys. So I must be lesbian. This was my child's dilemma, I'm quite sure. She came out as a lesbian at around age 16 or 17. I should have seen signs way, way earlier, but like any good parent, I blinded myself and didn't see them. And I think she really thought she was a lesbian at that time. But but she was as confused as was I. And so that's a fairly typical thing. Some people figure it out definitely earlier, but that's fairly common. And then some people don't determine that they are transgender until well into adulthood. This can be much more painful because a lot of life has gone through. Relationships have been formed, marriages made, children born, jobs developed, careers developed, and there's a great deal to be lost in making that transition. So at this point, I want to turn this over to Tami. And Tami, can you tell us, when did you figure this out?
Can anybody hear me? Can you hear me? I initially figured it out when I was about 5 years old. I told my mom that there was something wrong, that inside I was a girl. And she turned around and went and told all my aunts and uncles and everything. I tried doing the typical male role model things, typical boy things. Ended up going to a private school, Foursquare Church, private school, but never fit in with a lot of the guy stuff. And had a couple embarrassing incidences there. One day we were playing basketball and the floor was slippery, so I took my shoes off. And I forgot, I painted my toenails red. That was not too good. Ended up in the principal's office. It does happen. People are and often identify at a very young age. Unfortunately, society doesn't really support that at that youth, and my dad and parents would have never accepted it. I initially transitioned when I was 24, some 30 years ago. I didn't have the support then, and I realized that, and it was a partial transition, no name change or anything, and I realized I didn't have the support and went back trying living as a guy, and I went in an immediate depression and attempted suicide. Fortunately, I was by the cliffs and people saw me there and they pulled me off, and I ended up going into counseling then, and shortly after that I ended up joining the Christian church and became a born-again Christian, and it helped focusing on God and Christ and ministries, but the thought that there was something wrong never went away. I ended up going into a typical male career, engineering technician, and ended up marrying at 33. My ex-wife knew of the issue, but thought it could be subdued. And it came out again during the marriage, and the church, the conservative church I was going to, sent me to reparative therapy, which tries to say basically that it's nurturing upbringing, and unfortunately it didn't work. I went to another ministry here in Portland called Portland Fellowship, and they couldn't help me either. I ended up in all, going to probably 6 therapists and over 100 sessions. I was pretty obstinate. I didn't want to accept my my diagnosis, and every therapist I went to all diagnosed me as a trans. Finally, one therapist here in Portland said, "I'm very worried about you. You're slipping, and I'm really worried that you're going to have problems unless you confront your condition." And I did. And I remember one night at home tearfully accepting that I am a transsexual. And I found once I broke through that barrier and accepted myself, transition was very easy. I went back to school, became a caregiver, and then I graduated as a nurse. Unfortunately, I did not avoid legal complications in my ex-wife, and the churches we were going to could not handle me transitioning and with my child around, and I ended up in what was eventually a $60,000 court custody trial. In fact, this church was very supportive. The former pastor, Brenda Seen, stayed with me the entire 2 days trial for support. And I ended up winning the trial, but I learned a very good lesson in that I won the right to have equal custody with my son, but I didn't win his heart. And that I had to earn on my own. And so he would come over my place, but he was very distant, playing the games, the computer and this and that. And when it was time to leave, it's like, slam the door and leave. I had to turn the other cheek, and every time he went out the door, I would say, I love you, son, no matter what. It took 4 years of him struggling with me, and then one day he comes walking in my door, puts his stuff down, turns around and gives me a big hug. And he goes, I love you. And I go, well, what prompted that? And he goes, because you've loved me unconditionally for 4 years. And he goes, I'd rather have a transsexual parent than a tombstone to visit. We're very close. We see each other or talk to each other 2 or 3 times a week. I mentioned the forum here, and unfortunately he's taking midterms and not available. But he's very supportive of me now, and we're very close.
If someone asked me why I used to be a boy and now I'm a girl, I would say that I have a girl brain and a boy body, and I think like a girl, but I just have a boy body, and it's different than you.
Is it okay to be different?
Yes.
Do you like it? Because why?
It's okay to be different. It's okay to be different because it just matters who you are. It doesn't matter if you're different than anybody else. It just matters if you're having a good time and you like who you are.
Her name is Jazz. She's 7 years old, and she's all over YouTube. So you can look her up on YouTube. She's so cute. She's so cute. And it just matters if you're having a good time and if you like who you are. I especially like the like who you are business. So she obviously was raised in a supportive environment. She couldn't be this healthy and be put down by her parents. I think she's just charming. So what are the issues that folks who are face when the gender identity does not match the assigned gender? Well, one of the big issues is health care. How do you find a doctor who will help you get the right hormone therapy to make a transition? That would assume some expertise in the area, but it also assumes an acceptance that it's okay to transition. This is especially problematic when teenagers want to transition. Pretty significant medical legal issues. You know, if a doctor prescribes testosterone for a young girl who wants to become a young boy, and she's 14, and the decision is not a well thought out one, those hormones cannot be totally reversed. They can be stopped, but not everything will reverse. So that doctor is going to have to feel pretty confident that that right decision has been made, and some doctors are not even going to look at it. They'll say, you know, not me, I'm not your one. I remember my own child saying, I have cried so many tears calling offices to see if I could get care. This is the child of a doctor who can't find a doctor. So think how hard it must be. So securing appropriate medical care, feeling like the medical care that they receive respects them, having forms at the office that reflect some semblance of reality. What do you check? Male, female? What do you check? What do you tell your insurance? Male or female? What do you tell your employer? Male or female? If you're not sure, if your gender identity and your presentation, if who you think you are is different from the way you've been living and the clothes you wear and the height and the body build you are, it's a real issue, especially around the time of transition, but I think the problems continue as well. I like to tell about a story about a patient of mine named Max. Max came to my office and started receiving care when he was about 60. Very, very, very small man, big gray beard, very, very crippled. He'd been working for years in the business of making carpentry, and he had really used his body. He had been born a young woman and transitioned at around the age 17 when he could no longer stand living at home because he felt so strongly that that he was a man, and his family wouldn't accept him. So because he had to leave home, he never finished high school, and he worked a lot harder in his life because he never got the education that he probably would have had he been able to stay in his own home. He had such bad arthritis, needed many orthopedic procedures, and it took years for him to finally consent to seeing an orthopedist because he was so fearful of what that other doctor would say. He was so fearful of what would happen to him in anesthesia. Would people be telling jokes about him? Would they be making fun of him? Would they respect that he had a body that didn't match the way he was living his life, the person he knew himself to be? He's still alive. He was thrilled the last time he came in, and I revealed to him that I too have a transgender son. And boy, did he open up then. Just told me all sorts of stories because I think he finally understands that I get it. So that was kind of a cool visit. Employment is a problem. Some people quit their jobs at the time of transition out of necessity. They're forced to quit. Some quit because they just can't quite face becoming a new person in front of old colleagues, fearing rejection. So employment is a big problem. It is not as much of a problem in some areas. I'm not exactly sure what the status is in Washington or in Oregon, but I think it's similar to Washington. At least we have laws on the books in the state of Washington saying that you can't discriminate because of gender identity. But that doesn't mean that discrimination doesn't happen. But at least there is some legal recourse if people do experience discrimination. Education, especially for these young children. The parent of a child who is transitioning is going to need to do a great deal of education of the teachers and administrative staff in that child's school, the counselors, the Boy Scout leaders, the Girl Scout leaders, parents of children that come over for play dates, so that that child gets assigned to the appropriate sports team, can use a bathroom that is appropriate for that child, is allowed to go to church camp and stay with the group of kids that child identifies him or herself to be. So there's a lot to be done in terms of education. Military service is probably simply out. Safety is please pardon my spelling errors. It says safely, it should say safety. My son told me the other day, he'd be glad to march in some protest marches, but he dare not get arrested because of the safety issue in jails and prisons. So even if it's a stand-in for some sort of civil rights thing, he dares not to become arrested. I could get arrested, I'd go to jail, but I'd be safe because I'm the same sex as I've perceived to be, and I probably would be sent to the female side of the prison, but I would not like to be sent to the male side of the prison. That would feel very, very unsafe, probably would be unsafe. So safety is a big issue. Recognition by family. This is where my family has been blessed, but all families are not blessed. There are many children who are kicked out of their families for being gay and lesbian, but even more so for being trans. And this is where I want to ask Maisha, what are you seeing in your line of work and in your studies?
I would definitely agree with you that it makes a really big difference to have a supportive family. For youth who come out to their families as trans, they are at a much higher risk to be kicked out of their families than, you know, things like pregnancy or drugs. Like, you're a lot less likely to get kicked out for those types of things, but they're at higher risk for those as well. So they have these compounding issues where not only are they dealing with having a body that isn't what people are not recognizing them as who they are based on their body, but they also are at a higher risk for things like alcohol and drugs and getting kicked out by their families. They just have like a lot against them.
Hate crimes are still being perpetrated against transgender people, and I invite all of you to attend a Transgender Day of Remembrance service every year. There are just so many hate crimes still perpetrated around the world against people who are transgender. So please remember them, and vote for legislation if you get a chance. Here's the picture. Here's Tami and her son.
Yeah. We went on a joint Oregon Coast trip 2 years ago, and we had a lot of fun. And he's much taller than I am. I'm 5'5". He's 6'3", 190. Don't ask me where he got it.
Where did he get that?
Yeah.
So what are the issues facing parents of children who are transgender? And I want to extend that to not just parents, but grandparents. One is coming out. It was months before I told anyone outside of our immediate family that my son had decided to transition from male to female. I have a supportive family. Why did I keep this so hidden? Well, I had to come out. I had to figure out myself what to do. And coming out is a continuous issue. I was at a physician meeting yesterday morning. The conversation was, do you have children? Yes, I have children. What do you have? Well, do you want the long answer or the short answer? So it's, you know, coming out is something that you have to do again and again and again. I'm sure Tami faces it. Who do I tell? Who do I tell this long story to?
Yeah, pretty much.
And until they hear this whole story, that other person doesn't know Tami, doesn't really know her. So at least some people in our lives we need to come out to. Perhaps not everyone, but we need to come out to some, because we all want to be known for who we really are. And part of who we really are is who is our family. Fear of safety for one's child. I remember the first time that I saw Henry go into a men's bathroom, it was, oh my gosh. And this is with an adult child, but there's still that fear. There's an importance in educating oneself, reading books, reading internet articles, going to PFLAG, finding out what other people have learned, finding out what the issues are. So for any parents or grandparents, I urge you to buy some books, read some books, check some books out, look at some video clips. I brought a bunch of books back there, and I'd be willing to part with most any of them for free if there's a parent here who needs to read that, or a grandparent here who needs to read that, because I really feel strongly that people need to read, they need to find out. Advocacy for one's child, going to the principal's office and saying, my child was beat up because she says she's a girl and the other kids are saying she's a boy. And standing up for that child, even though the parent is not so sure that the parent is comfortable with all that yet. The advocacy has to be there. We're going to skip the next two because I want to enforce those a lot. Modeling acceptance to others. I guess I can't touch that. If we model that it's okay to use the word trans son, trans daughter, trans man, trans woman. If we model that it's okay to tell the truth, others will understand that it's okay to tell the truth. But if we model secrecy, then secrecy will be expected from others. So we as parents need to model an image of acceptance. We need to be really strong in listening to our children, and that includes listening before they come out as trans, listening for those hidden messages that are there, being willing to say, "What did you say? Really? You think you might be a girl? What makes you think that?" Engaging the conversation, keeping the conversation going. And then finding support for yourself and your partner. This is kind of a trying thing for a couple to find out that their child is not who they thought they had. I remember going through about 4 months of grief. It wasn't a motherless child, it was a childless mother. I felt like I had suffered the death of a daughter. And I didn't, and I can laugh at that now, but it didn't feel laughable at the time. It felt really very, very painful. And so if you know of people whose child has just announced, be supportive of that person. It feels like a death in the family, and it won't always feel that way, but for a while it does. This is the kind of trauma in a family that can tear a family apart. Let's get back to these two up in the upper right-hand corner. Avoidance of damaging behaviors and engaging in supportive behaviors. What in the heck would that mean? Well, there's a woman in San Francisco, Caitlin Ryan, who's done some very important research, and she interviewed many Latino and non-Latino, non-Hispanic white young people, both adolescents and young adults, who identified as gay, lesbian, transgender, bisexual, and asked them about parent behavior. And she carefully cataloged all the behaviors that were read by the children and young adults as either rejecting or supportive, and then looked at the suicide rate, the drug addiction rate, and the rate of engagement in dangerous sexual behavior, and found quite a difference. Children who are raised in a highly rejecting family are 8 times more likely to attempt suicide than those in a low rejection family. And even those who experience a moderate rejection, some acceptance, some rejection, are at increased risk of suicide attempts, but not nearly as those who experience a great deal of rejection. So I think this speaks loudly. We have to stop allowing children to commit suicide. We have to stop the behavior that leads them to that desire. And this is part of, I think, our job as Christians. We cannot tolerate that. So what are the behaviors? Some of you, I think, picked up a brochure at the back. It's called Our Transgender and Intersex Children. Do any of you have that with you? Hold it up if you do. Lisa, you have one there. There you go. Black and white. Raise it up high. That's a new brochure that is sponsored by Reconciling Ministries Network, so your organization, the Parent Steering Committee, and it's for parents whose children have just come out as transgender or whose children have been identified as intersex. Many of the issues are the same. And in there is a list, so I hope you'll all pick it up on your way out, of helpful behaviors and harmful behaviors. Well, let's go through these. Behaviors that help. Talk with your child or foster a child about their identity. It has to be something that you can say. You have to be able to say the words gay, lesbian, transgender, trans son, trans daughter. You have to say those out loud. So talk to them. Express affection. Well, what does that mean? It means hugging them, telling them you love them, giving them kisses. It means the same thing as affection to anyone else, but it means hands-on, not hands-off. Support your child's identity even though you as a parent or grandparent may feel uncomfortable. It means advocating, going to the principal, going to the employer. You might not want to go to the employer. You might want to help your child figure out who is the person to go to, because they need to fight that battle on their own. But standing there with them if they need help. Going to the court with them if they need to do that. Requiring that family members respect that gay, lesbian, transgender child. Insisting on proper behavior by extended family members. You will not ask your trans brother to be a groomsman. That came up in our family. Oh, I'm afraid that Sherilyn's grandparents won't be comfortable if Henry is a groomsman. No, that is not acceptable. This is your twin sibling. You will do this. And it went out fine. But, you know, that kind of tough love. You got to do this, kiddo. You just have to do it. Bringing your child to GLBT organizations and events. Take them to the Pride Parade. Taking them to PFLAG events. Taking to lectures. So that you show to that child that this is something we can deal with. This is not a secret we have to hide. Connecting your child who's transgender with role models. How do we expect a trans child to know that, just like any other child, the sky's the limit? You can be what your education and your training and your aspirations and your skills allow you to be, and it's not limited because you're transgender. But this is what it might look like. This is what you might look like. Finding role models. Welcoming your child's gay, lesbian, and transgender friends into the family and their partners, because not all families are going to welcome them. So sometimes this means taking in an extra child for a night or two. And believing that your child has a happy future. Truly believing it, knowing that it can happen. There we go. Behaviors to avoid. These are pretty obvious. Hitting, slapping, physically hurting. Verbal harassment. Excluding GLBT youth from family events and family activities. Blocking access, saying you can't go on that internet site where you explore transgender. No, we have to allow this. We have to allow them, and we have to guide to make sure that it's not exploitive websites, but they need to learn. Pressuring a child to be more or less feminine than they feel that they really are. Don't you really want to wear a dress? Don't you really want to have a wedding dress? I said. No, Mom, I don't. I want to wear a suit. So we did that. That was in the androgynous stage that I couldn't see. Telling your child that you're ashamed of them because of the way they look or act, that would be possible. And that's not a good thing. Keeping secrets.
I think another one is to be supportive of the child's goals and aspirations. And I know with medical transitions, money is a really big thing. And so sometimes for trans youth, it's a question between, are they going to be able to have access to the medical care that they need, or are they going to get to go to college? And so helping them find ways to save money and earn money, and supporting them in that so that they can both live as the person that they are and get an education or get a job or do whatever it is that they want to do is really, really key.
I think support is probably the predominant positive thing towards transition. I was fortunate to have 3 close friends in this church in full support through my transition, and without it, I don't know if I would have made it.
So what are churches going to do? How would this church respond if this couple showed up in the pew? Well, who are these people? Are they male, female, kind of androgynous, kind of in the middle? How do you turn around and you greet people with the Spirit of Christ, and you turn around and you find a person in transition? Not clearly not male, not clearly female. How open is your heart? Can you accept and see in that person, this is an image of God. Even though you might see long hair and curls and a beard, how are you going to accept that person? So these are my kids. my daughter-in-law and my son Henry. But I think he looked pretty androgynous there. I don't think he was totally believable as a man. And I suspect that it was kind of difficult. So what can churches do? Well, be aware of your attitudes. People will come into this church, especially being a reconciling church, who are in transition. These people need to be greeted openly, and I'm sure they are, with loving arms and not too much alarm. Well, how do you know whether somebody is male or female? Well, most people give a lot of clues. You know, if you're wearing a dress, you're probably trying to be a woman. So there's that clue. But a lot of women, all sorts of women, wear pants. That's probably the majority. So how do you judge? And young people tend to wear clothing that is maybe a little more way out there, and it's not always clear to old folks like us exactly what the presentation is. So if you don't know, you can ask. Tami, can you tell us a good way to ask?
Non-judgmentally, and do not
give us some words.
Do not judge them. I can't think of any right now.
How would it be if I said, "Welcome to Portland First United Methodist Church. We're so glad you're here. By the way, do you go by male or female pronouns?"
Okay, that'll work.
Would that be okay?
That'll work.
Would that be okay? Mm-hmm. It'd be better than referring to you as it. You know, that wouldn't be good. Or failing to invite you to some event.
That one I've seen happen at churches. Not really here, but I've seen that at other churches. And I've even seen situations where they don't blend in very well and they're pretty much not even invited.
And that's where attitudes get in the way. If we're not comfortable, we're likely to retreat in silence. And that silence is deafening. Mm-hmm. So we need to get past it. So if you don't know, ask. Ask, what pronouns do you like? Do you identify as male or female? It might be a little uncomfortable. It might be hurtful. But at least it allows you to go forward. It allows you to say, I really hope you will come join the women's group on Saturday. Or I really hope you'll come help us with this men's group project. Rather than saying nothing and then they don't get invited. That's exclusionary. So don't make assumptions about a person's sexual orientation. You may be wrong. Don't make assumption on where they are in terms of hormones or surgery, and probably those are pretty private medical things that shouldn't be asked. You know, it's not really appropriate to ask if you had a hysterectomy. You know, we don't ask that of our female colleagues and people that we know. That's absurdly personal. They might offer it, but we're not going to ask. So it's not appropriate to ask whether somebody's taking hormones or whether they've had surgery. If they offer, then that's an offer of intimacy that should be received as intimacy. And with the same level of confidentiality you might treat somebody else's medical issues. Don't assume that they have had surgery. Don't assume that they want surgery, because they may not. Tami and Maisha alluded to the expenses. Medical transition is really quite expensive and seldom covered by insurance, or at least all of it's not covered by insurance. Sometimes hormones will be covered, but surgery, I think, is never covered.
No, not yet.
Yeah.
No.
Not yet. Not in this country.
Very little.
So, so we can't make those assumptions. And someone who is dressing as a female may or may not want to have surgery or hormones, but if the person is dressing as a female, that person wants to be taken as a female. If you need to know some of these other issues, you can ask. But be prepared not to get an answer, because you may be delving into something that's too personal. And so just accept that. Don't assume that you know another person's gender or sex. All as we know is what they're showing us or telling us. And you may not have any idea. You may not know that the person is XXY. How would you know? All as you know is that person is presenting as a male or telling you that they're male. Don't assume that people that make you uncomfortable with their sexuality are uncomfortable themselves. So your own level of discomfort may be your own issue and not that person's issue at all. Educate yourself about transgender issues and keep the lines of communication open. Forums like this, I think, are very helpful for keeping the lines of communication open. Get support in processing your own reactions. If you're uncomfortable, so are others. You're not the only one if you're uncomfortable. Be an ally. Stand up for that transgender person. Even think of teaching a Sunday school class. Think of reading a book at Children's Moment up in front of the church about transgender issues. There aren't very many of them, but there are a few. And then if you want to know more, here's some very good resources. These are listed in a couple of places. They're on the handout that you have. They are also mostly listed, well, some of them are listed on the back of the pamphlet as well. And I have copies of most of them in the back at the table if you want to take a look at them. They can be mostly downloaded from the internet. But I urge you to get some resources. There's one there from Wallingford United Methodist on preventing suicide in young people. I think that's a particularly valuable one. Tami and Maisha, I'm going to ask you to say whatever else it is you'd like to say. Please join in, and then we'll ask for questions.
Okay, well, I wanted to give you some statistics to go along with what I was talking about, that trans youth face a lot of hardships, more so than their straight or gender normative presenting peers. So some of this information is a little bit old, but these studies were done about within the last 10 years, so they're relatively accurate. In a national survey done by the Gay and Lesbian National Network, 44% of LGBT students were physically harassed because of their sexual orientation, and 30% because of their gender expression. Youth who don't present in an exactly feminine or exactly masculine way are a lot more likely to be harassed for that. Whether or not they actually are gay or lesbian or trans, they may not identify themselves that way. There was a survey in 1999 in Washington, just north of us, that found that 80% of the students who were experiencing this type of harassment were not identifying as gay, lesbian, or trans. They were identifying as heterosexual and cissexual or cisgender, which is the term that we use. This is one we didn't talk about yet, actually. But instead of saying, I'm a person who is not transgender, or I'm a normal person, or I'm a typical gendered person, since that's kind of problematic language, I would identify myself as somebody who is cissexual, C-I-S. And that's like a cis-Atlantic flight is a flight that goes across stays on that same side of the Atlantic, whereas a transatlantic flight goes across the Atlantic, if that makes sense. So I am cisgender, and probably a lot of you and a lot of the people you know are cisgender. And so we use that term so that it's not as problematic as saying, oh, I'm a normal person, as compared to you trans people who are weird, since that's kind of no good. We also have 60% of students felt unsafe at their school because of actual or perceived sexual orientation, and kind of breaking that down, 30% of students, LGBT students, missed at least one day of school because they didn't feel safe going. They also have a lot higher risk of drug and alcohol addiction and misuse. They're 5 times more likely to report that their friends also use drugs and alcohol than their straight and cissexual peers. the statistic on this one is that 38 to 60%, it's kind of hard to determine exactly, but 38 to 60% of LGBT youth smoke cigarettes, oftentimes on a daily basis or frequently enough that they're addicted to it. So those are just kind of some statistics that are a little bit depressing. There's more. I'm going to leave these, this information up at the table with the books at the end of the session, and you can read through them if you'd like. But there's also statistics in here on depression and suicide rates, that type of thing. So that's really rough. I also just have a little bit more information about trans youth specifically, because I think there's a big difference between generations as we kind of become more comfortable talking about these issues and as sort of identities and communities change over time. There is, I can't think of a community that is changing terms as fast as the LGBTQ community. I mean, cissexual was a term that I don't think existed 10 years ago. And I guess the biggest thing that you can do, and we talked about this a little bit already, but the biggest thing you can do is ask people how they want to identify and really, really respect that. Do they identify as a trans man, one word? Do they identify as a transgender man? Do they identify as a man who maybe went through a transition at some point in their life, but maybe that's really not something that they want to consider a part of themselves. They want to be seen just as a man, and that's all. Do they want to be seen as a trans fag? Some people are okay with that, some people really are not. So I guess one of the biggest things is just finding out what terms that person is comfortable with, because it's going to vary by people. Some people have reclaimed terms that other people consider very derogatory and offensive. Some people are okay with saying, I'm a tranny. Some people are not at all. So the best thing you can do is just ask and really respect what that person says, and also be a confidential person for that person. Just because they're out to you doesn't mean they're out to everybody. Make sure you know if this is something that they're comfortable with in what types of scenarios. Is this something that you can talk about with your friends or with your family or with your church congregation, or is this something that they want to keep just between you or just in certain circles? Maybe they're not out to their family, and if you mention something to their parents, it could get them kicked out of their home. It could get them verbal or physical harassment from their parents. It could be something that would be really unsafe for them. Another thing is bathrooms. Advocate for having gender-neutral bathrooms or single-use bathrooms where only one person goes in there at a time. And if that's what that person wants, if that's what a transgender person in your life would prefer. But oftentimes they would just prefer to use the bathroom that matches who they believe they are and who they are. So support that too. I heard of a case where a school went out of its way to follow the recommendations of counselors for this trans youth. This was, I think, a middle school. And they designated a specific gender-neutral bathroom that this trans youth could use. And this trans youth was harassed a lot more than they would have been if they had used the bathroom that they felt most comfortable in. So that might not be the best option for everyone, because they had to go out and use this special, different bathroom. It singled them out. So don't police bathrooms, and support the bathroom choice that the person wants to use. One of the problems that I think is really difficult for trans people to face is a lot more significant increase in likelihood of having bladder infections and urinary tract problems because of holding it all day, because not knowing where there's a safe place to pee. There's actually a really fantastic resource online that's safe2p with the number, safe2p.com, that lists, you can look by city and it will list public bathrooms that are available, and it'll say if they are gender neutral or if they are single use, and kind of talk about, like, if you need to purchase something to use this bathroom or whatever. So if you're a trans person or you're with a friend who's trans and you're going out for the day, you know where you can go to a restaurant and have access to a bathroom that's going to hopefully not be policed by other people, that type of thing. So that's a really good resource. Really, just the internet is a great place for finding out a lot more about trans communities and the issues that trans people face. I know that Carol talked about educating yourself. That's a really good place to start, in addition to using books. The internet is oftentimes where these things are changing the fastest. And so to really get an idea of what trans communities are looking like now, especially for youth, like that's a place where youth can congregate really easily and find other people who are experiencing similar things as them, and be able to find like a safe haven that they might not have in their everyday life. So being able to go to those communities and just read about them and learn about them is really, really helpful as far as being an ally. And also just attending things like this. By being here, you are being an ally. You are being an advocate for trans people, and that is fantastic. And I'm so glad you all are here doing this, because not a lot of people take time out of their lives to do this sort of thing, and you're making a difference already just by being here.
I also want to elaborate on a couple of the things Carol said. Most transgender people going through transition live at or close to the poverty level. Transition is very expensive. The suicide rate for transgendered people going through transition or just dealing with the issue is about 16 times the national average. And in the Portland area, I know I'm very good friends with an MD in the area, there are about 3,000, maybe more, transgender, transsexual people in the Portland area.
Questions?
So where do you go, Tami or Maisha, to seek adequate physical health care? How do you find those sources?
Well, you can ask the internet. I find Google is a great source. If you just search like trans counseling or trans-friendly like medical care, I know there's a database, at least for Oregon, that I found just Googling that type of thing, that will identify what physicians you can go to who are going to be comfortable with who you are and refer to you by the right pronouns and the correct name and all of that. Also, I work for SMIRC, the Sexual and Gender Minority Youth Resource Center, and we actually have a program called Umbrella Community Counseling that is open to people of all ages, not just youth. The idea being that we are creating allies and advocates for youth who will then help them to go on to create a better world. And the counseling is very, very cheap. It's a sliding scale. It starts at, I think, $10 for youth per session and $20 for adults, which, I mean, where are you going to find, like, as affordable counseling as that for people who are really going to treat you for who you are and support you.
They could also use the 211 resources. Just get on the phone, dial 211, and they have resources for assistance through there.
There is one resource listed on the back of this brochure, the www.glma.org, Gay and Lesbian Medical Association. It's sort of useful. It's not terribly useful. It would be more useful if all of you asked your doctors to join this, if they would be willing to put their names out there. But a lot of them won't do that, but it just indicates an openness, and some people have some actual expertise, but at least openness is a beginning, if not expertise. Yes?
We talked a little about what the church can do, or those of us that are involved with religious faith communities. Mm-hmm. And do you have suggestions that might be helpful in the case of a youth, particularly a young adult, who has been harmed by rejection in their religious experience and or family, to ways that we can specifically reach out and say, hey, there's a welcoming place. You don't have to, you know, reject all of your religious beliefs because of this bad experience.
Right. Yeah. My friend Andrew considered coming to this panel, but we just didn't really have enough time to get him included, and I don't think we would have had enough time in the session for him to talk about his experience, but he told me a little bit about it, and he's comfortable having me share it. So he grew up in a Lutheran family, and about the time that he started recognizing that he was male, not female, and started really trying to explain this to his parents and his family was about when he was a middle schooler. And it was at that point that he told his family, I don't want to go to church anymore because it's a really uncomfortable experience for me. You know, I have to dress up like a girl, and I'm not. And you know, when he told his I guess pastor that, you know, he wanted to be a male, they said, well, as long as you don't like boys, because then you would be gay. And he's like, well, so he's like, you know, when I go on testosterone, that might change. Sometimes it does, but I have to tell you right now, I'm kind of into guys, and I'm a guy. So I guess just trying to be as supportive as possible. And I think you all already have the tools to do that, and knowing, like being able to be educated about these topics and just, I mean, you know how to be loving people. Like that's something that you learn from Christ. And to just continue extending that to people, unconditional love, which we've talked about, and accepting people for who they are, using the pronouns that they prefer, and just saying, like, look, there is a place for you in this church. This is a place that welcomes you and recognizes you for who you are, and is not going to make you prove yourself or dress a certain way, or be anything other than who you are, and we will love you just the way you are. I think that's the biggest thing you can do.
I think we like to assume that young people are more open than older people, and I don't think that that's a safe assumption. So I think having some sessions with the young people's group here to open their eyes that all of the people that they know may not be straight, they may not be cisgendered, they may be transgendered, and my guess is they're probably really open to that, but they need to hear it. They need to really have a discussion about it, and then that youth group may be less threatening to the person who has been damaged by another youth group or by another church. But I don't think you can invite someone in who has been harmed into a church if you really are not ready for it. And so that youth group may need to be prepared. They may need to talk about that before the person comes into the youth group and experiences even more rejection. So it would be a perfect topic for a youth group. Okay, please take one of these on your way out. Thank you so much, and I'd be glad to answer questions.